Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Structured Clinical Interview for DSM Disorders assesses diagnosable mental health conditions based on criteria from the Diagnostic and Statistical Manual of Mental Disorders. It evaluates major psychiatric disorders such as mood disorders, anxiety disorders, psychotic disorders, substance use disorders, and personality disorders. The main purpose is to provide a reliable and standardized method for clinicians to establish accurate psychiatric diagnoses. This tool enhances diagnostic consistency and supports clinical decision-making in mental health practice. The Structured Clinical Interview for DSM Disorders is indicated for adult patients suspected of having a wide range of psychiatric conditions, including mood disorders, anxiety disorders, psychotic disorders, substance use disorders, and personality disorders. It is most useful in specialized clinical settings, such as psychiatric hospitals, outpatient mental health clinics, and research environments where precise diagnostic assessment is essential. The tool is designed for populations requiring a standardized, reliable, and valid method to establish DSM diagnostic criteria. It facilitates differential diagnosis, treatment planning, and outcome evaluation. Studies demonstrate high inter-rater reliability and diagnostic accuracy, particularly when administered by trained clinicians. Its structured format ensures consistency across diverse patient populations, including those with complicated or comorbid presentations. The Structured Clinical Interview for Diagnostic and Statistical Manual of Mental Disorders consists of multiple modules targeting specific psychopathological disorders. The clinician begins by selecting modules relevant to the patient's presenting symptoms. The interview contains approximately 130 items divided among modules addressing mood disorders, psychotic disorders, substance use disorders, anxiety disorders, and other conditions. Questions are primarily closed-ended, requiring yes or no responses to assess the presence or absence of diagnostic criteria. Some sections include rating scales with frequency or severity options, typically ranging from 0 to 3. The interviewer follows a standardized sequence for each module, asking questions verbatim to maintain consistency. Responses are recorded on a structured form, allowing for objective assessment of symptom presence and duration. Scoring involves determining whether the participant meets the diagnostic threshold for each disorder based on the number and combination of endorsed criteria. Reference values correspond to diagnostic criteria specified in the 4th or 5th edition of the manual, allowing clinicians to classify diagnoses accurately. Interpretation must consider that a positive endorsement does not equate to a diagnosis in isolation, but must be evaluated in the clinical context, including symptom impact and duration. The Structured Clinical Interview for DSM Disorders demonstrates high sensitivity and specificity in diagnosing various psychiatric conditions. Sensitivity refers to the tool's ability to correctly identify individuals who have a particular disorder, minimizing false negatives. Specificity measures its ability to correctly exclude individuals who do not have the disorder, reducing false positives. In clinical studies, sensitivity values for the interview often range between 0.8 and 0.95, indicating a strong capacity to detect true cases of mental illness. Specificity typically ranges from 0.75 to 0.9, reflecting reliable exclusion of non-cases. For example, when assessing major depressive disorder, a sensitivity of 0.9 may imply that 90% of true depressive cases are accurately diagnosed. Simultaneously, a specificity of 0.85 suggests that 85% of individuals without depression are correctly identified as such, enhancing diagnostic confidence in clinical practice. The Structured Clinical Interview for Diagnostic and Statistical Manual of Mental Disorders originated in the early 1980s, developed to address the need for a standardized diagnostic tool in psychiatric research and clinical settings. Initially designed by a team led by Dr. Michael First and Dr. Robert Spitzer at Columbia University, the instrument was created to enhance diagnostic reliability and validity according to the criteria outlined in the third edition of the Diagnostic and Statistical Manual of Mental Disorders. Subsequent versions have aligned with updates to the Diagnostic and Statistical Manual, including the fourth and fifth editions, ensuring its continued relevance. Validation studies have consistently demonstrated strong inter-rater reliability, with kappa coefficients frequently exceeding 0.8 for major diagnostic categories. Research by First and colleagues established criterion validity through comparisons with expert clinical diagnoses, showing concordance rates upward of 85%. Further empirical evidence supports its construct validity, as the structured clinical interview captures distinct diagnostic constructs corresponding closely to clinical presentations. The instrument's semi-structured format has allowed for systematic symptom assessment while permitting clinical judgment, contributing to robust psychometric properties across diverse populations and settings. Overall, the Structured Clinical Interview for Diagnostic and Statistical Manual of Mental Disorders has been extensively validated, making it a benchmark tool in psychiatric diagnosis and research. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.